From stress to diet and to gum disease, your mouth does leave patterns, and I'll show you exactly what we are looking for. This isn't guesswork. We do look for clinical patterns for which we are trained to look out for. For example, with periodontal disease, i.e. gum disease, we look at certain qualities of the gum and the teeth, i.e. bleeding gums, tooth mobility, recession, and tooth movement. So we don't look at for one side, we look at the overall picture. Number one, when I look at patients' teeth, I first look at for tooth wear. So if I see signs of flattening teeth, that could be suggestive that the patient is clenching and grinding quite a bit. Alternately, if I see cupping or dips in the back teeth like puddles, then that could be suggestive of a lifestyle where there's acid intake. This is just not an opinion. There is research, and very well-known research, that tooth wear is linked to grinding, clenching, as well as acid intake, such as fizzy drinks, including things like lemon water, vinegar, salad dressing, as well as acid reflux or vomiting in certain conditions. So yes, your teeth can quietly tell me if you love fizzy drink. Next, we look at your gums. If your gums are swollen, red, bleeding, it is a red flag. According to the NHS, bleeding gums can be one of the signs for gum disease. Now, with gum disease, it happens in stages. In the earliest stages, called gingivitis, it can be reversible. However, if it's left untreated or ignored, it can lead to gum disease, which is periodontal disease, which does do irreversible damage. Healthy gums don't bleed, full stop. Now, when I look at your gums, I also look at your tooth positioning and also the level of the gums are sitting on your tooth. If your gums have shrunken or if the teeth look longer, it can be suggestive that your gums have receded. Gums can be receded for a number of reasons. It cannot always be a serious cause. However, if there is tooth mobility, bleeding gums, it can be suggested advanced gum disease is present. A lot of people say, I have sensitivity. Sensitivity is not a sign or symptom. We're looking for patterns. Sensitivity in itself has got different categories. It's a very broad symptom. For example, you can have sensitivity to cold, you can have sensitivity to sweet, to brushing. It can be a number of things. That's why we look out for the cause and pattern. According to data, dentin hypersensitivity has got multiple causes. That's why it's very important to find out what's the cause, what's the pattern, so we can diagnose it. For example, if two people have got tooth sensitivity, they can have two completely different diagnoses. Number 5, I often get an idea what sort of diet you have from the oral cavities you have in your mouth, as well as where the location is. For example, certain cavities due to frequent sugar consumption can have different characteristic, or to those where you're drinking fizzy drinks and you have a habit of swelling the fizzy drink in your mouth, can have a different category of cavities. According to research, those who consume sweetened drinks do have a poor oral health outcome. It's not about the sugar consumption, it's more about the frequency. And importantly, NHS England do recommend regular dental checkups even if you feel fine and you feel no pain. A lot of the elements I mentioned in this video are symptomless. So a lot of the signs are quite silent in nature, and they do give symptoms much later at the end stage of a certain dental disease. That's why please do see your dentist for regular checkups. So next time you're in the dental chair, don't assume we are judging you. We're looking at signs, patterns, and history so we can come to the overall right diagnosis for you. Every patient's different. Diagnosis is tailored to a different person, will be completely different to another person, even if they've got similar symptoms.